Yo, what's up, guys? This is David Huang coming at you from supplementsuperhero.com, and today I'm going to be doing a quick review of Metformin. So this is a Metformin review where I'm going to be going over some of the benefits as well as some of the side effects. And I've never tried Metformin before, and I don't plan to, just in case you're wondering. But the reason I wanted to do this is because my mom's diabetic, and she's been diabetic for a really long time. I think it's been about 10 years now, a decade, where she's had to actually inject insulin in herself. We've actually had to inject insulin for her, I should say. And just recently, our doctor actually prescribed some metformin in addition to the insulin, which, kind of sucks because it's more medication for my mom, and I'm actually more of a preventative medicine, preventative treatment type of person. Like, I prefer people having a healthier diet, taking supplements, and exercising as opposed to taking medication. But in my mom's case, with her situation, she really doesn't exercise that much. She doesn't have the best diet, so really medication is kind of the one thing that's keeping her blood sugar stable right now. So, recently did some research on metformin because she was prescribed this medication. So I just wanted to do a little bit of research, and I figured I'd share some of this research with you guys. But yeah, I've been doing a little bit of research, and overall, I was a little surprised that there's a decently good amount of information in terms of some of the benefits related to metformin. So metformin is like the most widely used medication for diabetics. It's sort of like the first line of medication for diabetics, because it's shown that it does help with blood sugar levels, it does help your overall blood glucose levels, and it does that by increasing your insulin sensitivity. So that means when your body pumps insulin through your body, you're able to utilize it a lot better. Okay, and then it also helps to lower the amount of glucose that's being produced by your liver. So that's why it's essentially able to help stabilize your blood sugar levels. But on top of that, I did find one article where I listed some pretty interesting benefits to metformin. I have the link in the description below if you want to click it and check the article out. But they say that metformin can in some cases help to fight cancer. There have been some studies that have been shown to help fight breast cancer in women, and also pancreatic cancer. So that's pretty interesting. Obviously, the whole thing with like preventing and fighting cancer is definitely a little controversial, but some studies have shown that it's been able to help fight the onset of cancer in some cases. Two, it helps to promote some good bacterial growth in your stomach, so it's good for your overall gut health. As you know, we need good bacteria in our stomach for proper digestion, and it does help promote that, according to some studies. Some studies also show that it helps with glaucoma, which are it's kind of a group of eye diseases, which makes sense. If it decreases your overall blood sugar levels, it makes sense that it's going to help support prevention of glaucoma and eye disease in general. And then the fourth one is pretty interesting. They say that according to some studies, it does help to fight and treat polycystic ovarian syndrome, or PCOS, which I didn't really know. But they say diabetes and PCOS, or polycystic ovarian syndrome, are very much linked. A lot of people who have PCOS are also diabetic or pre-diabetic, or they say that it's caused by insulin resistance, so it makes sense that they're connected. So by lowering your blood sugar levels, it makes sense that the onset of PCOS would decrease. So pretty interesting. They say metformin is something that's kind of on the rise with people who have that. And then number 5, they say that it helps to really prevent full-blown type 2 diabetes in people who are pre-diabetic. Okay, so people who have essentially pre-diabetes, who have somewhat high blood sugar levels, but aren't quite high enough to become diabetic. Usually doctors will prescribe metformin as a way to help fight that onset of diabetes. So by taking the metformin, it does help to stabilize your blood sugar levels so that you don't get full-blown type 2 diabetes. So those are some of the benefits that I found about metformin. But of course, with any sort of medication, there's always side effects that you have to watch out for. Obviously, one side effect is getting too low of blood sugar, especially if you're already taking insulin. And that's something that I'm a little worried about with my mom. If I give her both insulin and I give her metformin, are her blood sugars going to get too low? So that's one thing I'm scared of. And if your blood sugars get too low, it can become very dangerous. And sometimes it's even worse than having too high of blood sugars. So that's one thing to keep in mind. Although, I mean, if you use it as suggested, your blood sugars typically won't get too low, but that's just one thing to keep in mind, especially if you're combining it with other meds. They say that a lot of gastrointestinal problems can be a major side effect. I actually talked to the pharmacist about this. Usually within the first 1 to 2 weeks or so, give or take, of taking the product, you might get upset stomach, you might have some diarrhea, you might feel really bloated. So gastrointestinal issues can be a big side effect as well. Third side effect is nausea, feeling nauseous, feeling dizzy. Another side effect is some abdominal pain from taking the product. And then, what is this? Okay. Anyways, they say it's also not good. Sorry, I was a little distracted there. But they also say it's not good for people who have kidney problems and liver problems as well. So if you have some sort of disease, condition, or if you're taking some sort of other medication that's messing with your kidneys, that's messing with your liver, combining it with metformin might not be the best idea. They say that can lead to a lot of complications, and it should be avoided if possible. So, anyways, that's my brief review of metformin. Again, that's just kind of based on some of the research that I've done and that I've seen online. I'll link some of the links to the articles that I've read in the description below if you do want to read those and check it out. But let me know your thoughts, guys. Please leave me a comment in the comment section below. Let me know if you have any questions. Let me know your thoughts. I mean, have you taken metformin before? Have you talked to people who have metformin? Do you have diabetes? Are you pre-diabetic? Do you have PCOS? I want to hear from you guys down in the description below. Comment section below, I should say. Sorry, it's been a long day. Okay, anyways, guys, thank you so much for watching. Have a fantastic day. And as always, sup it up.